Good afternoon, everybody. I'll be presenting over here LUMI INDENT. As we all know, basically in a vitreoretinal surgery, we need 3 hands, 1 sister and 1 doctor. So when we go inside for surgery, we require somebody else to actually indent for us, and that is basically our sisters who assist us. So at that time, that could be slippage, or that could be miscommunication between the sister and the doctor, and that could be a lot of accidental retinotomies. So basically, we need 3 hands and 3 instruments, and there could be a lot of complications. So we wanted a solution where we could make the depressor and endo-illuminator together. That's where we came with the LUMI INDENT. These are my co-authors, and the solution what we found out was using a hypodermic needle cap and putting the endo-illuminator inside this, and then sticking it with the micropore. So basically, this is a very easy to do thing, because everything is actually on the table in our OT setup. So this is how we would do it. You put a transparent hypodermic needle cap and then stick with micropore, and you can see how brightly the endo-illuminator illuminates the whole thing. So using this makes it very easy for us to do it with 2 hands. So here you can see how beautifully a trans-scleral approach of indentation with illumination is done, and this becomes very easy for the surgeon to use the other hand to use a cutter or the illumination, and you can see even the disc is illuminated very well. So this becomes very easy for the surgeon to actually recognize the second instrument and use it to cut the vitreous or even do the endo laser, and we don't really require another assistant to indent for us. So you have both your hands available to do this. So this becomes very easy. Now you can see how in a vitreous hemorrhage case, the peripheral vitreous is being cut with a cutter. So basically, this is a technique which has been done before, but then it was not. It didn't take much popularized because the illumination was very less with the other instruments. But with LUMI INDENT, we have quite bright illumination for illuminating the retina periphery. As you can see, the laser also can be done very easily. And what if you don't have an endo illuminator? You can take a insulin syringe and you can put the LED light into it and then connect it to a battery source. So this can be done within 100 rupees, and it can be also attached to a power bank. And this can be used even in OPD setups. Even you can use it for indenting in scleral buccal cases. And it can be sterilized as well, except for the part of the battery. You can have quite a long wire for that. So now, as we know, the surgeon itself can indent and also do there are a lot of other instruments for different companies, but then the problem is it is only limited to that particular brand. And then there was another illuminator which is used with a cotton bud. So, but the problem is when you cut it, the scissors becomes blunt, or there is nowadays there are all earbuds which are coming in paper form, and when it becomes wet, it loses its form, and then you cannot indent it very easily, and it will also bend the illuminator. So all these problems have been removed by this LUMI INDENT, and it is a do-itself, easily replicable, and it is made using discarded materials, can be sterilized, is very sturdy. It emits light diffusely and covers a large area, and without illuminator also we can do this. And as PGs and fellow in your beginning stage, it was easy for you to actually do it in the OPD and make them understand where the indentation is happening. Thank you. If you there's
first check. It's on. No, in what way it is different from the one which is, because we use one commercially available. It is like a similar sleeve. Yeah. In fact, in that only the tip illuminates, not the shaft actually. In the model you have given, even the shaft also illuminates. Sometimes it's disturbing externally when we are seeing through the indirect. So in what way it is different from what is available commercially?
So whatever is available now is not actually available for everybody, sir. So in an institution, it is a difference today because you get those instruments. But for a private practitioner where you have an Alcon machine and you have the DORC which is providing you the illuminator. So we have different machines that those people are not going to, and it is always customized towards their brand. So it will be customized to as their illuminator, only their illuminator can use it. But over here, the best part of this thing is you don't require any kind of money investing into this. You have things already on the table. You're just rearranging it in such a manner which you can use it very, very efficiently for a surgery like this. You don't have to depend on any other instrument or anything. It is just a very do-it-yourself thing.
Now, my only concern is the smoothness of the tip, because if you see the outer cover of the, it's very ragged. So when we are indenting, and especially when the patient is under anesthesia, the force given is variable. So it can injure the conjunctiva also, which I personally feel is not, there with the commercial level, because they have smoothened the surface.
But again,
so that's the only issue.
That's the only issue. But when we tried, sir, it actually didn't have that much of a problem. We used it. Actually, the edges are curved around, circular. So the point of contact which comes is very less, and it actually won't poke. It doesn't poke, because the edges are round, circular in fashion. It's not square or rectangular, so it actually doesn't poke. And we've tried using this for past 6 months. We have not had any kind of problem. And then even the other one, the insulin syringe one, it has a tip which is rounded, which actually is much better than the one which we use as a 26 gauge cap.
But there the only issue is maintaining the sterility while doing the surgery.
But then only the battery part is little difficult to sterilize. But the whole, we have a longer wire. So what happens is the wire is sterilized, only that part can be used as a...
we already have so many wires actually. We are adding one more wire to the surgery. Right. Thank you.
Thank you.